Welcome to the Men's Health Unscripted podcast with Patrick and Cam,
where we focus on your entire health, mental, physical, spiritual, and emotional to make sure you are good to go every day.
Welcome to the Men's Health Unscripted podcast with Patrick and Cam. And we got a very special guest today, one of my mentors in the pharmacy game, Dr. Chelsea Green. Dr. Chelsea is the Green Queen, a forever young pharmacist and preventative medicine and genetics health advocate. She is the founder of Green Roots Optimize Wellness, aka GROW, where she works as a genetic genius, helping her clients reach sustainable, optimal wellness results utilizing their unique genetic makeup as a map to hack your health. So, Dr. Chelsea, that's a mouthful, but we're going to have a great combo today.
Welcome
Thank
on.
you. Thank you. Thank you. It's been in the making, and I'm glad we can make it happen. And I'm honored to hear that you call me your mentor, Pat, because untraditionally, I have thought of you as, leading this space as being like a mental health and a men's health advocate, and has been very inspiring to me as I continue to grow my own practice.
Well, thank you so much. I appreciate that. And Dr. Chelsea actually taught me a really fun trick with Eliquis that I've used on a few of my clients. It's a great, icebreaker. You'd be like, hey, I think I can lower your dose of Eliquis, make you a little safer, stop those nosebleeds. And so it's cool. So maybe I taught you a little bit about mental health. Maybe you taught me a little bit about Eliquis. But today, everybody's going to learn about genetics. So let's just kind of kick it off. How did you get into the genetic space, and what prompted you, maybe after becoming a pharmacist, to pursue further education on studying genetics and how it impacts your life?
So I have, a very traditional pharmacy background, and I've been working in the industry for over 10 years now. And I have seen firsthand how preventative care and not taking care of ourselves throughout your life can have a big impact on, your older years. And that was just in my traditional role. And then it hit me a little bit more personally about 5 years ago. My mother had a stroke at a very young age, under the age of 50. And it kind of led me into this world of discovery to look more at my own genetics, because not only did my mom have a stroke, but her biological mother and father both had strokes, and they both dealt with a lot of mental health concerns as well. And this kind of led me to believe, under the age of 30, this was potentially my destiny as well. So really kind of broke me into more of the preventative space and looking at my own genetics to see what risks I was at potentially for developing inflammation, vascular concerns, and then eventually mental health concerns as well. So it kind of spun me in that direction more than the traditional Western medicine direction, truly, because I wasn't getting answers from those providers, unfortunately.
That's unfortunate. That's kind of how you got pushed into this, because it's something, can't really speak for what school you went to or what they taught, but for us, we have a pharmacogenomics class. So they started to push kind of the importance of genetics on how your body works and how your health can be related to it. And we are seeing kind of a swing for a lot of healthcare positions as well, kind of getting towards that understanding that genetics does play a bigger role than what we know about, and things like that. So would you mind shedding a little bit of light on exactly what is pharmacogenomics? What kind of interplay do you deal with during practice?
Yeah, so pharmacogenomics is a subset actually of pharmacy, where they look specifically at your genetic makeup, how you metabolize certain drugs to then tailor treatments and make better drug choices for you. A lot of what, in school, we were taught mostly about certain immune therapy drugs, or even psychiatric anti-epileptic for seizure. Those are the medicines that we truly typically would get genetic or pharmacogenomic information on. However, a lot of times as the preventative strategy, that those aren't baseline things that are looked at. When you go into a doctor's office, you express any sort of mental health concerns, they blanket put you on potentially a medication, when truly you may have different enzymes or different makeup to say that this probably is not the best choice for you. And unfortunately, like you said, you don't know about my schooling, and it wasn't taught extensively. It was actually an elective. And when I'm working in practice, I typically don't see any providers ordering or even looking at some of these factors when they're prescribing medications, which, no shame on them. It's not like they were truly taught either, but now it's kind of getting more and more brought into light that these are opportunities for us to be more precision and tailored to our patients.
Yeah, before I started pharmacy school, I worked in the pathology area, and I was more of a lab manager, but I definitely did a lot of extractions and protocols and things like that. And we had started with doing some genetic testing at the lab, buccal swab stuff. And I was one of the experimental ones just because I was in the lab. So I got this whole really cool printout about what drugs work better for me or not. And you come to find out that there's sometimes whole classes of medications that are out for people. It's been a long time since I looked at it, but I think the only really issue I had was like if I was to take warfarin or something at some point in time in my life, I am not a good candidate for that drug. So good thing there's other newer, nicer anti-coags out there if I ever needed it. But that like it would be potentially a bad reaction if, let's say, I did need it at some point in time and I take it. I don't think I was a very good metabolizer of it from what I remember.
Yeah.
So
yeah, and that was, and you talk about warfarin and like blood clotting. That's one of like the more common things that providers test for, as far as like blanket panels. Because I remember going to my primary care doctor and being like, "Hey, my mom just had a stroke. They don't know the cause. What can you do to help me identify what risks I'm at?" And they did do a blood panel to see what type of blood clotting risks I was at. And lo and behold, I do carry a gene that does put me at risk for blood clotting, which then in sorts kind of puts you down a path to choose certain medicines or avoid certain medications and lifestyles to then reduce your risk of blood clotting. So that one is very common to be tested and is very necessary and needed to kind of even rule out certain conditions as well.
So a little side note, when I was initially kind of getting introduced to genetic testing prior to pharmacy, insurance really didn't cover it. And if it did, it only covered it once. Has that changed over the years? Because I would say this has been about 6 years now, at least 7 years. Is there any change in the insurance model where they are actually allowing this to happen once or more than once? Because then it just was really non-existent and it was pretty much a cash pay business.
Yeah. So patients that I work with, it's all cash paying to figure out what your genetics are. I do know that certain medications, if you have concerns, your doctor can order you the specific blood test and genomic testing for that drug. It's not guaranteed that it is paid for by the insurance. I do know that more testing is coming out more for our geriatric elderly population to get further testing done. And this again is more of a tailored response to psychiatric medications. It's kind of more geared towards patients that are in assisted living, in memory care, in skilled nursing facilities that are seeing these psych providers, and they're really trying to just manage their mood and their mental status living in these conditions too. So as of now, there's not much change in the practices. However, I think it's more being asked for by the providers because of the patients are being more autonomous and being advocates for themselves, or they read about something or they heard from you on your podcast promoting some options for them. So I'm anticipating that it will be more in the insurance space, or at least have opportunity for it to be ordered.
Yeah, I think the way that's unfortunately is going to work out is the same as it always does. I didn't see it, and I still don't see it in the VA system as well. And the government is always the one that leads this kind of stuff. So I would expect us to kind of see it in the Medicare model eventually. And it's unfortunately going to be one of those, like the patient will have to fail probably a few different modalities before they decide, okay, now we'll cover this testing. And turns out 1 and 2 was incorrect because of genetics. So I feel well, keep an eye on the government Medicare model might Medicaid, Medicare might give us the better idea of when this might happen, but that's probably what we'll see at first, Pat.
Yeah. And it's definitely readily available, more like direct to patient testing is available. there are, certain concerns like, oh, what if you uncover that you have a certain genetic condition? Like, what type of counseling that needs to go with that? So I think that has been some of the stigma, or even like the societal concerns about getting this testing, direct to consumer versus within your provider status. But a lot of those companies that do offer it, they do have built-in plans for you to speak to a genetic counselor in the event that something, scary pops up for you.
That's interesting. I'm interested in seeing how this is going to shift over the years, because there's been so many leaps taken since I was ever even introduced to it. I would say in probably 15 or 16 is the first time I even knew what this was. So it's grown a lot. It's going to continue to grow. And I think some really interesting things are going to come out of it. But let's go ahead and dive into how your genetics impacts you with Dr. Chelsea. So let's start off with, we've discussed it a little bit on the podcast. What's epigenetics? How does this impact our genetics? And just kind of fill us in on there, and then we'll take it from there.
So you must understand, your genetics, you're born with it. You talk about, do you retest it? Typically not. So when somebody is born, you're born with your DNA, but it doesn't necessarily have to predict or predetermine the rest of your future just because you have a certain gene or a certain condition. So everything that's around you that you interact with, external factors can have an impact on the expression of your genes, whether they're turned off, whether they're turned on, whether it's like amplified or even depressed. So every opportunity, whether it's like an environmental stress, an emotional stress, a physical stress, food that you intake, the toxins from our food and our environment that we intake can have an expression in turning on and off how our genes, work. And this can simply look like, hey, I know that I'm at risk for inflammation based on my genetics. And if I'm going to continue to eat, high toxic foods or continue to stress my body and fill it with oxidative stress and inflammation, it's not going to have the best impact on my genes. It's going to age me faster. Inflammation in your body is truly an early aging of your cells. So epigenetics is a way that we can modify the expression of our genes without actually changing the coding of our gene to begin with.
That's a pretty good definition. I like that. It's different than what we've heard before, but really the same kind of factors. What are you eating? What are you drinking? What are you consuming, from all different facets? And I think that's maybe just a little bit more fancy sciencey term than just general consumption. But so how can a guy's genetics, since this is men's health, how can a guy's genetics impact their susceptibility to maybe some chronic diseases like dementia, diabetes, blood pressure, things like that?
So when the testing that I do, it looks for low penetrance genes. So it looks at a combination of different genes in a pathway that can potentially predispose you for cardiovascular concerns, diabetes, bone issues. So I know some of the more common ones for men, or life concerns for men growing older, are either cancer, cardiovascular concerns, depression. So our genes do play a big factor here, whether we are understanding or know that, hey, my father had cardiovascular concerns, had an early heart attack, maybe that's already in my genes. What am I doing now to help be proactive in that space? Whether it's I'm taking a fish oil, I'm doing low resistance training, I'm having a lot of cardiovascular endurance type exercises. I know what I'm eating. I'm maybe minimizing some of the meat products that I'm eating, because some of these are ridden with inflammatory markers or carcinogens for our men's that may even have issues, breaking down certain hormones. So I would say that some of the biggest concerns for men are like the cardiovascular concerns, the cancer concerns, the diabetes concerns. It really starts with everyday habits and what you're doing and what you're putting into your body. It can seem like a big change. You walk into the doctor, you walk out with a new diagnosis of diabetes. You have, let's say, being gracious, like 5 new medications, because it's not only your diabetes. We're also now controlling kidney concerns and blood pressure concerns. So that can be overwhelming for a lot of patients. I know you probably have dealt with patients like that on your day-to-day too. And just giving them sustainable opportunities to make changes on a regular basis to then build the habits of creating a healthier lifestyle, because it doesn't change overnight. It can take, 3, 6, 12 months to really get an understanding and a grasp to take your life back and under control.
Yeah, it's true. So keeping some of those risk factors and some of those, lifestyle things in mind, are there any kind of genetic factors that may affect men and their health? And then what can we do to prevent both the genetic? We can't really prevent the genetic ones, but how can we prevent like those effects from taking that hold of us and kind of directing our health to an unfavorable position?
Yeah, so a lot of things that we're missing in the foundations of our health nowadays are truly our nutrition. I think like that is the biggest backbone, the misunderstanding of how there's really a lack of nutrition or a lack of micronutrients in our foods. So just being aware of that and how any type of micronutrients could be affecting our mental health, our cardiovascular health, and then focusing on our sleep, our stress, our exercise, really looking at the base or the backbone and the foundations of these men's health to then build sustainable opportunities for them to improve and to have a better outcome. So we talk about like cardiovascular concerns. A lot of this can be like you have bad vasculature where your veins can be less resistant and they become more, just more hardened. And this can then lead to conditions with high blood pressure, and trying to even do certain exercises like massaging of your legs, or even having certain foods and nutrients that can help promote vascularity and help promote nitric oxide release can really sometimes make the biggest difference. Being in tune with what those genetic factors are, and then making the chance to understand them to be able to make the change, I think is the most sustainable reality that our patients and our clients have. Because if you don't know why you're doing something, you're less likely to do it. So I really try to empower and educate and advocate for my clients to do that for themselves too.
So yeah, there's one thing, all jokes aside, I think that you missed, Dr. Chelsea, is guys love their boners, right?
Nitric oxide.
Right.
So yeah,
Their
nitric oxide got
sexual
bad
health.
thing about penises.
Yeah, like I think that's like the one big thing we hear about is like, all right, cool, it's going to help this and that, but like, how am I going to
What about your
perform?
sexual health? Yeah.
Right. And our demos are like right around our age, like in the late 20s to, I'd even say up to like the 50s, like late 50s. But I think, having a good sexual like health life is very important for a lot of men. And I think what happens too, not to get too off on a tangent on it, but if something's going wrong, they'll feel a little bit inadequate and they can kind of, and then they'll hide it. Right.
Spiral.
Right. And so we go all nuts. And there's just an opportunity to address it, right? And then even understanding if you have a genetic concern for cholesterol. I know the lipoprotein little a is a indicator of like genetic issues with cholesterol and overproduction of cholesterol. But there's other genetic markers. Like I haven't gotten it tested, like specific genetics, but I have a family history of heart disease. Like on my dad's family, they drop like in their 50s, first heart attack. And I know that based on like my dad and his dad, they didn't really take great care of themselves. And so I know that 3 generations on my father's side, and I've really got to watch it. So I got to stay on my cardio and eating right and things like that. And I also thought another point that you made was really important is that our food kind of doesn't necessarily always have the micronutrients that maybe it would say on the labels, especially vegetables or things that are grown if the soil's depleted. I mean, there's a bunch of factors that are way beyond my scope of knowledge, but you do know that over time, some farms, they get depleted in nutrients. And so some people need to supplement with the important micronutrients and even macros to be able to get the nutrition that they need. Have you seen that people genetically might have certain deficiencies, like a zinc deficiency or something like that, they really need to ramp up supplementation?
Absolutely. So there's a whole section of the panels that I work with that specifically focuses on nutrition. And not only does it test in the zinc, it also tests, folate, what your response to salt is, your caffeine, your vitamin D, your vitamin C. But those aren't truly the backbone of the micronutrients of our body. We look more specifically at potassium, sodium, magnesium, and calcium. And these are like the four that we want to absolutely have in balance. What I'm seeing a lot in the clients that I work with is they have deficiencies in sodium and potassium, which then ultimately reduces their ability to be able to digest their food and to be able to absorb the nutrients that they actually are eating, whether or not they're eating the right macronutrients or micronutrients. I think that's a big difficulty too, with eating the right macronutrients, the carbs, the fats, the proteins, like that's a backbone. And then you think about micronutrients and we're lacking that. And like you said, that's a topic for another conversation. However, a lot of the lowered or even elevated micronutrients that I'm seeing in my clients, it's related to stress. And it can be physical stress, it can be mental stress, it can be the stress that our environment is putting on our body from just what we're intaking. And that ultimately can trickle down into our reproductive health or our reproductive performance, specifically for men. As like a contrast between, I don't know how many like woo-woo or like feminine healthcare providers you've had on here, but there really is a difference between like the masculine energies and like being in your head versus like the feminine energy and being more in your body. And I think that a lot of men could benefit from seeking more answers from their own body versus the societal stigma of, oh yeah, just rub some dirt in it. I'm a guy. Let's just keep going. And I think those are a lot of the stigmas that you and Cam are trying to, break on this podcast too, is it's important for you to be in tune with yourself and not ignore the silent symptoms, the silent whispers of what's going on in your body until you're at like, oh, I'm never going to the doctor, maybe like your family, and then you drop dead when you're 50. Again, it's being proactive and promoting and being an advocate for yourself and the symptoms that you may be feeling or having.
For sure. I would
stigma.
say we're not afraid of a little woo on this podcast.
Yeah, see, we say that, but I don't know, because like, we're still also guys, and we still kind of face that stigma ourselves, and we definitely kind of fall into it during a lot of stuff. Like, I don't go to the doctor nowhere near as much as I should. I obviously don't keep myself in military shape anymore. Like that doesn't happen. And then Pat, let's be honest, in 17 years, you're gonna be looking at the end zone like, oh shit, like I got to make sure everything's timed out because that 50 is here.
Right.
Like we're keeping an eye on these things. Just I guess probably more than other people will. That could be our education. It could be our family background. What say it. But it's not everybody. Yeah, that's what we're kind of wanting to do, is reach out and just let people know there's some things to look at. You don't have to obviously take our advice and do exactly what we're saying, but just keep in the back of the mind. It's always helpful. And understandably, you do that in your practice as well. So do you actually do any of that stigma fighting with your genetic testing or your services you provide towards men specifically, keeping in with the Men's Health Podcast?
Yeah. So what I've found with the men that I work with is, it's kind of like a one-off and then they're done. So trying to keep wrangling them in and following up with them and asking them like how they're doing, how is your blood pressure? Have you been getting outside? I found with men, as you can maybe predict, I've had to do a little bit more follow-up and kind of like pull more out of them kind of what's going on to be able to best guide them or advocate for them in their space.
Yeah, I can understand that's got to be extremely difficult because like I do the same thing. You go to the doctor, you talk to about some things. So for me, going to the regular doctor, the VA, I do yearly visits, like yearly kind of checkup thing. And then every time you come back, like, oh, anything changed? I look at my labs myself because I want to be able to see what that's actually reading before they try to tell me the watered down version. And then if nothing's flagged on it, nothing's coming up high, I'm like, nah, we're fine, we're good. Go on our ways, things like that. So I can imagine, they get their genes tested. They know, oh, that's not going to change. So thanks for your service. I'm out the door. And you gotta be like, nah, motherfucker, get back in. There's other shit to do. Not you don't know what to do with this information. So I get
Yeah.
definitely, hopefully our listeners can understand the unfortunate uphill battle it's got to be for you to kind of help maintain your patient interactions every day.
Yeah. Yeah. And it is still very rewarding to work with them, because some of the highest praise that I have received are from my male clients. Like, you know, thank you for looking out for me. Like nobody else is looking out for me. So that does feel good. Primarily, I primarily work in a practice with, working with and for other females. So it brings a new perspective when I get to work with a male.
For sure. One more thing on the woo. I think like during your rotation, Chelsea, we did a little bit of breath work. I think somebody was like, "Are you yoga breathing over there, Pat?" And so I think we led like a like a very short 2-minute breath work really quick. Probably before like I had to present a project or something to kind of get everybody lightheaded and be like, "Oh, this guy's all right, he's cool."
He's competent.
Right.
No, and even now, like I'm sure we're in the same space, and I sit in my cubicle and I'm just breathing, and my coworker's like, "Are you okay?" And I'm like, "I'm just breathing and just trying to like regulate my nervous system here before I have to, pour out for somebody else." So I think that is something that a lot of men might be able to take with you, is just take a moment to take a couple deep breaths, whether it's like before you walk into work, before you eat your meal, have that moment of pause, of gratitude, of who made this meal for you, like what you get to enjoy. Because I think I live in a very masculine energy, just, growing up and being a high achiever. Like I've taken on a lot of those masculine qualities, and I forget to like stop and pause and like accept the gratitude and just be thankful for what's around me. And what I notice, like when I'm not doing that on a regular basis, or I haven't done it in a couple days, then I feel off, or I just feel like very in my head and busy thoughts. And, it's just helps you ground to be back in your body and to be back in the present space as well.
There's your woo for today. Yeah. So as you know, we're a big mental health podcast as well. And some mental health conditions can kind of trickle down through the generations. What type of genetic testing could someone get to maybe identify potential mental health issues, either for themselves or potentially something that they could pass down to an offspring?
Yeah. So when I speak a lot on mental health and mood and behavior, and also your memory and your cognition all together, because it's something that hits very close to home for me. And what I found when I'm specifically looking at someone's genetics, I like to look at genes that help them either build up or break down their neurotransmitters, or what makes them more just readily available in their body. I also look, uh, specifically at their folate intake. So some patients aren't able to necessarily metabolize or build folic acid based on their DNA. So then you can't take a regular form of folic acid, you have to take an activated form. And a lot of times certain foods in our diet may be contributing to the breakdown of our neurotransmitters. A lot of these are like fermented foods, or even histamine producing foods that can have an impact on our mental health and just us feeling kind of more foggy. There are about close to like 15 to 20 different genes that I test for that are in this mood pathway. And it's not to say that if you have one, you're at this risk. It's really about if you have multiple of these genes in this category, you're more predisposed or more likely to have mood disturbances. And looking at your genes, it could be like your receptors themselves don't have that great affinity or ability to grab onto the neurotransmitters, or like the shape is wrong, so they can't, function at their full capacity. So this is where we start to see some of those differences in our mental health. And what I really, like to emphasize is that our environment has such a big impact on our ability to stay balanced and to stay grounded. So if you're in an environment that's chaos and high stress, and you're your nervous system is dysregulated as well, that's only going to worsen or even fast track some of your mental health concerns. The last thing I just wanted to put on that is not all mental concerns are genetically related or genetically inherited. More so, the ones that we see are more of addictive type habits, schizophrenia, bipolar disorder, and depression are more the ones that are inherently kind of passed down through the generations in our genes.
Yeah, I hit the genetic jackpot. I got addiction in there too. So
I think most of us do, especially in the first
yeah,
world.
probably.
Or addicted, if it's not, it could be food, it could be sex, it could be drugs. Like those are still like addictive type qualities that a lot of people have it may not really think about as addictive problems. And like the addiction to social media these days, like that makes us more depressed too. That's on another topic though.
Yeah.
Yeah, I was
Yep.
going to mention that. I was like, a lot of people kind of oversee those ones because they're not as, quote, destructive, I suppose, as some of the other things. But a lot of people are really addicted to like the technology we have nowadays and that luxury it affords us. And then they don't, they discount it. Then it kind of snowballs into bigger problems. And like you said, it can kind of cause image issues and things like that. That is not the topic for today.
So I did kind of want to kind of offshoot a little bit on something that you said, enzyme activated like vitamins. So we'll say like folic acid, right? There's a huge correlation between mental health issues, I think more so like depression, anxiety, with improper folate intake. And I've probably seen at least 5 or 6 studies that all kind of confirm this. The methylated vitamin B kind of complex. So you have your methylfolate, your methylcobalamin. Can you explain a little bit about just how those are a little bit different from just taking like, I'll just call it out, a trash like vitamin that you're just going to pee out, and actually the ability to utilize these vitamins that are essential to your body and like essential to very many cofactors and reactions for biochemical processes that go on in the body. What are the differences between non-enzyme activated, enzyme activated products?
Yeah. So let's say, for instance, you have the gene predisposition where you don't have the MTHFR gene. So that is the gene that takes the regular form of folate and makes it activated to be able to be utilized within your body. So this is the same for any activated B vitamin. You touched on like B12, there's B6, there's B5. Like these need to be activated or methylated to be able to have quick and automatic ability for your body to use it. So even if you don't have the gene that makes it difficult for you to activate it, whether it's B12 or the folate, you aren't getting as much bang for your buck when you take these types of products, because you're still having to intake it and then your body converts it to an active form. A lot of times in these cases, it's like a prodrug. It can be less active, it can be less potent, so you're not getting the full dosing. And it also can be like, oh, like I get my vitamin B tested and it's low, but then I'm taking a supplement, and if it's not the methylated form, I'm not seeing any changes in my values. So it can be even shown in your lab work too that it's not having the greatest benefit because it's not necessarily the activated form, because your body can't use it for its intended purpose.
Yeah,
That's some of the really interesting stuff, the interesting body and biochemistry that kind of falls into a lot of these vitamin groups that most patients have no idea about. They just kind of get told, oh, you need more vitamin, B, you need more vitamin D from their doctors, and now they're in the aisle trying to figure things out. I love looking at, it's unnecessary, but I love looking at these vitamins and there's terms like methylated on front of it. Because a little story, when I did community pharmacy, I actually had an older patient come up and she's asking some questions, and then I can't remember if it was her paperwork or if she's reading a bottle label, and it had like methylated, whatever on it. And she like got all close and she was like talking very low. And is this meth? Does this mean like rub meth? And I was like, Jesus, it's like, no.
Yes.
Like, no.
Yes, it does.
I was like, do you think we just
Take
be selling
it.
He was like, do you think we should be selling it to you over the counter for $10? No. But she was like uncertain about it. And it's just unfortunate that she was kind of just told, oh, you need to just grab this off the shelf. Just grab a thing off the shelf, you'll be fine. And then, of course, as she was being proactive, which is great, she was reading the bottles, she was kind of investigating the quantities and things and looking into it. But there's all these terms that are used that aren't explained. And then, yeah, the patients are like, I don't know what the hell this is. Like, you're trying to put some weird shit in my bodies. Like vitamin D is a big one too, because they don't understand the difference between 1, 2, and 3, and then they're trying to figure out why they can't take 3, but they're getting 2, and it's a lot of good background, I guess, for patients to kind of learn about. So definitely appreciate you coming on to explain some of this mechanism and separations for everybody.
Absolutely. And I also think that some of our providers these days, they lean on the pharmacists to kind of help them because they may not have as much education in that realm. And it's not to the fault of them. They just, in the Western society, we just weren't taught those same things. I remember in pharmacy school, we really weren't taught those types of things. It's all after the fact.
Yeah, I learned a lot of that stuff from watching videos of just health people that I like. And I took like a 20, it was like a 20-hour CE on functional medicine. And it was given away. It was given away for free for pharmacists. A good friend of mine showed me. He's like, "Hey, do you have
Wow.
to do continuing education?" I was like, "You damn right I do."
Send that
And
my way.
yeah, I will. I'll forward it to you. But I think every year they offer it free to pharmacists where you get, it's like 20 hours of functional medicine, and they talk about enzyme activated vitamins and um like the different types of magnesium and zinc.
Hmm.
And there are so many just trash supplements that it's probably really cheap to throw it in a bottle and sell it to you for 10x, that probably a lot of companies see that opportunity and they're like, yeah,
Hmm.
sure. And you are probably getting a little bit of it, but to really get the most, like as Chelsea said, bang for your buck, really research what the type of, most absorbable forms of micronutrients and vitamins are. And you will probably go down a rabbit hole that you wish you hadn't, first of all. And second of all, you'll learn a lot about just how your body processes different things. And I mean, I kind of realized like I needed some supplementation somewhat recently. I was just kind of feeling like I was dragging ass, and I just didn't think I was getting what I needed out of the food I was getting, and started with some B and some zinc. And I mean, overnight, like almost, but I got really high quality supplements, spent a lot of money. Well, not so much on the B. Enzyme activated B can be cheap. It's like
Yeah.
$9 for like 60 tablets. I mean, you can get a pretty good shot for that. Um, but all different kinds of these supplements, like there's probably like 95% trash and then 5%
Hmm.
really good. You have to, we say it on the podcast all the time. If you're looking for supplements, look for USP, look for third party testing, look for good manufacturing process. Those are indicators that at least what you're getting is safe. A lot of these aren't regulated by the FDA, but also look and see what type of compound it is. And when you kind of do that, you start diving down, you'll find out some really interesting stuff just about your body and different vitamins and things. So I digress. But so how do you, we'll kind of get back on the mental health topic. So how do you use the genetics? Like you've taken someone's panel and let's say they might have some type of mental health issue, bipolar, depression, anxiety. There are different enzymes in the body that metabolize these medications in certain ways that make them more or less effective. So what are some techniques that you use to just determine how a drug might be metabolized by someone or even a supplement? And then how they can you get an estimate of how the body will utilize it and if it can be efficacious for them or if it's just going to be trash for them?
I want to break that question down just a little bit.
Sure.
You had asked about certain medicines that can, when I do recommend supplements for like mood and behavior, I guess, how do you select that and how do you know that they're utilizing it? So I can start there. I think that's what I understood. So a lot of the practices that I will try to help understand from my clients is what is causing them to have this type of stress. So when you say stress, it can mean a lot of different things. It's emotional, physical, mental, and even relationship type stress. and that causes inflammation in your body. And not all inflammation is bad, just like exercise inflammation can be good, but at certain quantities. Because after you hit a certain threshold of inflammation, you start to overproduce free radicals, oxidative stress to your body, and then it starts to break down and cause damage. So when we look at traditional lab testing, when I'm looking at stress and inflammation, that also can help support your mood, I like to look at markers of inflammation. So I can even have an ask to have doctors do lab testing for CRP to check inflammation out. You also can look at homocysteine as well as a marker for inflammation for clients. And then you can use that as a baseline to say, here's where you're at, and then here's how we're improving throughout their transition on whatever they're implementing. A lot of times, the genetic testing that I do, it also, when you talk about like specific medications that you can choose, it looks more at liver enzymes and how medications are metabolized through the liver. So looking at, CYP3A4, 2D6, 2C19, these are all like very common CYP enzymes that drugs are metabolized by, and certain mood medications undergo these pathways. So when a patient comes in and they're on maybe mood medications, that's one of the things I look at to see if they're being like an over metabolizer of this drug. So maybe they're not having the best benefit because it's just wiping through their body, or they may be a slow metabolizer, so they're not necessarily getting the right effect, or maybe they can use a lower dose to have the same effect, etc. A lot of times too, I recommend more like adaptogenetic products to help like reduce stress for people. One of the biggest ones is filling back up the nutrients that were being overused in this stress type cycle. So you had mentioned like I was feeling crappy, I took like a B vitamin. Like that's one of the first things when somebody is being overstressed, it's being utilized very quickly and used up. So a lot of times somebody is very B deficient. Also magnesium gets overused as well. So that's where it's really important to know what type of magnesium to choose, because there are like 10 on the market. There are then certain mood supporting medicines like GABA, L-theanine, rhodiola, ashwagandha, that can help support and suppress some of that inflammation in your body to help you feel like you're more balanced and a little bit more regulated as you're working. This is not going to save you in itself. You must be doing other things like, grounding exercises or journaling or working through the stress that you have, because just like pharmaceuticals, it's not going to be like a one size fits all, or just you put the medicine and it goes away. You're going to need to continue to work at it as well.
You mentioned ashwagandha, and it got me kind of thinking. So as we know, a lot of prescription medications, with your genetics, can be under metabolized, leading to toxicities and things like that. Are there common genes that you're able to test for that will show if certain like over-the-counter herbal supplements can be in the same kind of fashion? Because some of them do carry like liver toxicity and things like that. So obviously could be more risky for some people.
Yeah. Most of the products that I will tend to not recommend is more in like the hormonal space, because your body has certain liver metabolites that help you, women and men, metabolize estrogen. And there's certain supplements that may damper that down or maybe inhibit some of these metabolizing directions. So that's pretty much the only one that really comes to my mind. Certainly if I get further precision testing done to say, hey, this person, has a really high calcium level because of the stress they're under, they probably shouldn't be on XYZ supplement. Those are the tendencies that I kind of look into. One thing that I see very commonly and just out in practice is a lot of people are pushing vitamin D, take vitamin D, take vitamin D. But that's not always something that I recommend to everybody, only because it can have a play into your baseline, those four: magnesium, calcium, potassium, and sodium, can have an effect on those that I always like to try to check out first before I make certain recommendations. for like blindly supplementing.
Sure. I see a lot of blind supplementation here at my practice too, where it's like, my doctor told me to take calcium and vitamin D for my bones. And it's like, well, your doctor missed a couple other
Working
things.
out.
Yeah. Well, yeah, that too. But, just to kind of reiterate, there's no one magic pill, or there's like no one magic supplement or drug or anything that's really going to put you over the top. It's multifactorial. It's exercise, it's sleep, it's diet, it's all of it. And these things are just here to help you support and give you some additional nutrition that might be missing in food, or, even in some cases, I'd actually had a client who had come in a couple weeks ago, and she had already gotten genetic testing and told me that tomatoes were just out for her. It was like one of a few things. And so generally that's something that most people would see as a very healthy food. A lot of good antioxidants in tomatoes and potassium and all kind of good stuff. But like, this lady can't have it because it creates a ton of inflammation. So even some of the good stuff can get you.
Yeah, and it's funny that you talk about that, because that's actually the path that I'm kind of trended on as well, is kind of looking at more like certain foods and inflammation and how it, produces in your body. And the reason why I say that is, we think back to, 50,000 years ago when we were all on the same continent, we were all eating from the same sources, and then we were split up. But truly, our food has changed so much, and we're not really eating for what our DNA or what our genetics really intended. And that testing that I'm sure your client got, that's the kind of the premise of it, is looking more at what your body is at a genetic level needing to not produce inflammation. And I had recently gotten some of that testing done too. And, certain things that I think are healthy, like cherries, blueberries, soybeans, and chia seeds and chickpeas. Like, these are things on my list that like I'm not supposed to eat because it causes inflammation. But in other words, like, hey, you might be telling me to have a blueberry smoothie because it, helps with inflammation and antioxidants. But it's, everybody is so unique and so different.
I think a little bit of like botany background is also nice to have, because like you'd mentioned, like thinking about 50,000 years ago, I like thinking about, Unga Bunga living in his cave back in the day. It's always my thing. But like going with tomatoes, as Pat was talking about, tomato, as some of us know, belong to the nightshade family. So like, we're not supposed to eat that shit anyway. We've just kind of evolved. I don't want to say anyway, but we've evolved to the point where we're able to either process it or deal with the components in it that are harmful to us. And some people, yeah, you don't get those. Once in a while, they're shut off. And then you have some of those mal effects from eating these things that way back in the day we wouldn't fuck with. We'd see that and be like, nope, and right past it. So it's super interesting to kind of think about how much we've advanced and how far we've gotten as a species and scientifically and stuff like that. But like a blueberry can still take your ass down for a day, Crazy.
Yeah. And then, Patrick, you were talking about too, like the, even in the past, like 40 years, 30 years, even how much our food sources have changed, and really the lack of nutrition and micronutrients that's in our foods. And you said, hey, I had to supplement. Like, my goal is to not have you on supplements. It's to really, have you eating a variety and a diverse diet to get what you need. But truly, it's not really possible anymore. Because, if you eat one carrot in the 1950s, you now have to eat 50 carrots for the same like vitamin A content, which is insane to me, because you're not going to eat that much volume. And then you also think about people transitioning from like a carnivore diet to a plant-based diet, like how much more volume of foods that you need to eat to kind of get those same nutrients. And that's why you have to be so selective and so special, very focused on the right products that you're choosing as far as supplementation, or consider getting more IV supplementation, because that's more absorbable by your body and you may not have to do it as often either.
Interesting. So kind of as we wind it down a little bit, genetics can impact your fitness. And I had heard a talk from Dr. Chelsea about how genetics can impact your injury risk, how you develop muscle, how muscle breaks down, and kind of all sorts of things. So we'll finish, we'll round out the podcast with talking about how your genetics impact fitness, because that was one of the last things I thought about, how genetics could impact. Like, obviously some people are more muscular naturally, and things like that. But I never really thought about the, like the impact it can have on injuries and recovery and things like that.
Yeah. So I say that recovery is our best known tool, but it's like the most underutilized option that we have. I think this is a fabulous topic. Like this is like the performance and the athletic performance is like kind of like the field that I'm kind of moving into or more of a focus on, because this is just a niche that I love so much. And when you touched on, your inflammation. When you exercise, you cause inflammation. That's good for your body, but too much can be bad. So your genetics can tell you, how much recovery time you need in between really intense workout sessions. Or, hey, maybe it's not just taking a day off as recovery. It's I'm adding in other therapies to really help improve your recovery. Your genetics can tell you whether you're better for like power sports, which is like powerlifting and sprinting, or you're better for endurance training. Like, hey, my genetics tell me that I could be a marathon runner, but you have to train up for that. But I would have a great genetic capacity to be able to achieve those goals with the right plan. And what I think knowing about your genetics, it's really can help you set up a plan if exercising is really important for you, which all men and females, like exercise is so important, especially weight training, but you want to do it in a safe way because your genetics can also tell you what type of injury risk you're at, whether it's like a ligament or even your bone health. Ultimately, weightlifting can help support your bone health as well. It can tell you your response to how well you might respond to your training as well. So we talked about like how well you might respond to like an endurance training, but just in general, like, hey, I just started doing HIIT workouts and they feel really good for me. I feel like I'm getting a great benefit for them. You probably have a really high training response in your genetics as well. What I was going to mention too is your genetics can have, and how they kind of measure this is based on your VO2 max and your response to how much of an improvement in your VO2 max you might have. So this is actually something that anybody that has like a smart watch or like a training watch, you can measure as long as you do like outdoor walks or an outdoor hike to kind of get the metrics, but you should be able to track your VO2 max, and the higher the number, the better. It means that you have a better cardiovascular output and just response in general.
Yeah, I think the VO2 max, how I understand it, and somebody explained it to me in a very easy way, is your heart's ability to accelerate and get up to whatever it needs to get up to compete with whatever your body has going on. And then also the ability to re-regulate, come back down to a normal resting heart rate, and the time that it takes to go up and back down. And I think that's kind of how they measure VO2 max. The exact numbers and stuff, they slipped me, but the explanation I thought was pretty easy to digest. So is that kind of right around what it is?
Yeah, that's more heart rate variability, but they do correlate with each other as well as far as like your response to training. And that's also a metric that your health app in your watch can track for you as well. I think that's a great tool, if you're just starting off or like looking for your own health metrics, is to really look at your health app. A lot of people have like your smartphones track a lot of this for us already, like your sleep, even like your stress levels. Certain watches can track your heart rate to know whether you're more stressed at certain times of the day. And this can just be a good indicator as like a metric to say like, is it correlating with how you're actually feeling? Because a lot of times these feelings of stress, you're not even aware of them until something happens, like something manifests. So taking time to just notice those slight feelings, whether it's like your breath is quickening, your heart rate's fastening, your jaw is tensed up. Those are physical signs that you might notice even before you have the thought that like, oh, I'm stressed or oh, I'm angry. Like those physical signs typically come first.
always talk about is that awareness, because most of us lack it, unfortunately. So
That
it's
yeah.
always good practice.
That was something specifically for men. I think when I work with them is self-awareness. You know, you talk about, women might say like, oh, like be in tune with yourself, like listen to your intuition, but really it's just self-awareness. And how do we build that for ourselves?
Yeah, and Cam and I, armed with knowledge, makes us just horrible patients.
Yeah,
Same.
I'm not an ass. I'm just like, because I've had this problem with like therapists and stuff like that. Is yeah, we're horrible at because we can explain and we understand what we're doing and saying and all this kind of stuff, and then they're like, yeah, so I don't know what to tell you.
And
I'm like, yeah,
yeah.
that's where we're at.
And then
That's so funny. Yeah, I remember like the last time I went to the doc, I was just sitting there, and I don't go in and like tell them I'm a healthcare professional, because I don't want to be like that
I don't
annoying
either.
person. That's the I'm a nurse, I know more about my drugs than you do. Shout out to the nurses. Um, but and great people, backbone of the healthcare system, but no, you don't. And anyway, so I'm sitting there and they're just saying, hey, blood work looks good, and kind of giving me the rundown. And I was like, well, then how come your nurse like took my blood pressure on the right arm and I didn't have to sit down and do all that? And, just
and
like
they
trying to
actually did
throw
it
like bad
manually,
jabs.
and they just told us that it was normal.
I don't know about
Yeah, right.
anybody else, but when I learned how to take manual blood pressure, I was just like, yeah, that looks about right. And just like wrote it down, and I passed every time. So don't ever ask me to take your manual blood pressure.
That's why we have the machines. Like
Yeah.
AI sometimes knows better.
Right. The machine, like they pay attention, and I have such a hard time hearing that little click. And I was just like, 122/78 looks about right. And they're like,
You
oh,
saw
that's perfect.
you saw the little blip, right?
Yeah.
Yeah, so the needle move, you're like, that's it, right there, it's fine.
That's good.
We're around for you. We're good friends.
Well, Dr. Chelsea, thank you so much for coming on the show. It's been an honor to have you talk about genetics and how it can impact your life. So thank you so much. You're welcome anytime.
Thank you. We'll have to think of new topics and get back on here as I continue to expand and you expand as well.
For
Oh,
sure.
I'm sure there'll be some goofy patients walk in that we can definitely get into some topics on.
Absolutely. We can even just have like a powwow and talk about them.
Yeah.
Case studies, like just bring a case and we'll just talk about a case study.
That actually might
That could
be
be
fun.
fun.
That's not gonna be fun. I'm just gonna like recycle what I used from like first year. No.
3 pharmacists and a patient. Gotta love it.
Right. Cam's nuclear too, so his perspective is
It's a
probably
little different.
rapidly changing.
Yeah.
We all have different views.
All right, everybody, I'm going to go get some sleep now. Have a great one. Thank you, Dr. Chelsea.
Bye,
Thank you.
guys. Thank you.
Oh, the confetti.
Yeah, what the hell was that?